The common symptoms of carpal tunnel syndrome are numbness and tingling that involve primarily the thumb, index, long, and ring finger. Commonly it will wake up an individual up at night when they're sleeping. In some cases it will persist throughout the day and interfere with their daily activities. Sometimes it'll be associated with some pain. That pain can radiate as well up into their arm and even up into their shoulder. Individuals that get carpal tunnel typically will be around middle-aged individuals, both men and women, although it is more common in women, up to 3 times as common. We're not exactly sure why. There certainly is a hereditary component, so individuals that have it, their parents may have had it or family members may have had it. As well, it is commonly associated with repetitive activities. A common misnomer is, though, that it is caused by computers, but in fact carpal tunnel has been described in the early 20th century, long before computers were ever invented. Carpal tunnel can be treated both conservatively and surgically. Conservative treatment would include activity modification, especially if you have clerical work or a desk job. You want to make sure that your desk is set up correctly. As far as at nighttime, symptoms are common at nighttime, so some individuals will wear splints at night, which helps to keep their wrist straight, which takes the pressure off of the nerve, versus sleeping with your wrist bent, which can increase the pressure on the nerve, which can aggravate the symptoms. Certainly medications, anti-inflammatories, can improve the symptoms of carpal tunnel, especially if the underlying cause of carpal tunnel is an inflammatory condition like rheumatoid arthritis. As well, cortisone injections are a good alternative to surgical treatment. It does 2 things. It's therapeutic in the sense that it can alleviate the symptoms even up to an entire year. It also can be diagnostic in the sense of if an individual were concerned about carpal tunnel, I give them a cortisone injection and they respond favorably. I know in my mind and can reassure the patient in their mind if we end up, if he or she ends up requiring surgical intervention, they will have a good response to the surgery. Surgery involves just taking the pressure off of the nerve. There's a thick ligament that is over top of the nerve, and when that ligament becomes thick, that's when it puts pressure on the nerve and causes the symptoms of carpal tunnel. So with the open technique, you're incising and releasing that ligament, which takes the pressure off of the nerve, and you're doing it through an open incision in the palm. There's a newer technique, it's an endoscopic technique, which is my preferred technique in certain individuals, which is where you make a smaller incision in the wrist crease and you're releasing the ligament from the inside. It's less invasive. If you compare the 2 techniques, in the short term, the endoscopic individuals get better a lot faster. With the open technique, it takes much longer for them to return to their daily activities, return to work. In the long term, about 6 months or a year later, they do exactly the same. But again, in the short term, the endoscopic individuals get better faster.